During this time of COVID, and they were the unsung heroes. I just wanted to say, thank you to all respiratory therapists that was out there, busting, a lot of times you don't hear about respiratory therapists until.
Hi everyone, welcome back to my channel. My name is Nadisha, and on my channel I focus on personal and professional growth and development and also nurse entrepreneurship. Some time ago I had mentioned that I would be bringing on different healthcare professionals to talk about their journey in healthcare and to speak a little bit more about their position. So today I'm so excited. I'm going to be bringing on a good colleague of mine, Siju. Siju and I started in the medical ICU as nurses. He was a respiratory therapist, then he transitioned into a role as a registered nurse in the ICU to now being a nurse anesthetist. And he has agreed to come on my channel to share with you guys his journey in healthcare. I am so excited. So let's get into it. So, Siju, good morning. Thank you so much for agreeing to come on my channel and sharing your journey in healthcare with us. Your story is quite inspiring. Like, you did that. You went from respiratory therapy to registered nurse in the ICU to now being a nurse anesthetist. Wow, congratulations to you. So, tell us about that.
Good morning, Nadisha. Thank you for having me. It's a pleasure to, share my story with everybody. I became a respiratory therapist at the age of 20. I actually never wanted to get into the medical field. I was going to do computer science. Somebody told me, why don't you do respiratory? It's a 2-year program and you could, get a good salary out of it and help people. So I did that. The age of 20, making, good money, and really enjoyed helping people, talking to patients and helping them recover. I really enjoyed that.
So what made you want to pursue nursing after initially settling on a career in respiratory therapy? Why did you go the nursing route?
Nursing has a lot of advanced practice. You're a dialysis nurse, nurse practitioner. You could do a lot of stuff with nursing. There was a lot of options for me, more opportunities in nursing.
Okay.
So that's why I pursued nursing. And I knew I wanted to become a nurse anesthetist, so I wanted to pursue that.
I do remember in the ICU, a lot of the therapists, they would say that, sometimes they felt like respiratory therapy, if they wanted to advance, the next step would only be management. Whereas nursing, you could, like you said, you could be a dialysis, you could be a nurse practitioner, anesthetist, you could teach, the opportunities are endless. So
Yep.
I do understand, why you potentially made that decision.
Yep.
So what challenges did you face in the transition from RT to RN?
I don't know if I had any challenges. I'm not sure, but it made me more stronger to go into and more comfortable going into ICU, since I work with the nurses in medical ICU all the time as a respiratory therapist. So I knew what I was getting into. So
some of those nurses, those personalities, my gosh, they had strong personalities.
That's true. You gotta, yeah.
But you were always a favorite because you're just so calm, you're so composed. So I can see how it wouldn't be much of a challenge for you. So at what point did you know you wanted to be a nurse anesthetist?
So I think maybe in the 3rd year of respiratory therapy, I wanted to, go into nursing to become a nurse anesthetist.
Okay. So were you able to work while in the anesthetist program? Because I hear that program is pretty intense.
No, it is recommended not to work. It is a very intense program. So they have about 500 applicants. Out of 500 applicants, they probably interview about 50 applicants. And out of that, you get about 20 seats in the program. So it's very competitive and you only get one chance. And if you mess up, you can't go to another program. So it's highly recommended. You need to have at least an 80 out of 100.
Wow, that's pretty intense. I had anxiety just hearing about that. So I can't even imagine 3 to 4 years of just that intensity.
Intense. Yeah, it's very intense.
What challenges did you face in the transition from registered nurse in the ICU to now being a nurse anesthetist in the OR, which is a completely different role and a completely different setting?
So the challenges I face is more prioritization to a higher degree because you have the patients right there. It's one-to-one. You have one patient, not like in ICU, you have 2 or 3. You have to troubleshoot and figure out what exactly going on within seconds and fix it.
Did your role as a respiratory therapist help in making this transition easier?
Oh, yes. It definitely helped me in so much because we work with events all the time as a nurse anesthetist. So I know a little bit more than the average person, average nurse in working with ventilators. So it really helped me. And
the reason why I ask is because I remember sometimes in the ICU when you were the nurse and the attendings would be asking, they can't find the respiratory therapist, and they're like, "Where's Siju?" Some of the residents, they would be looking for Siju when you're the nurse now and no longer the therapist, but because you had
that was a little bit, yes, that was a little bit hard. So I had to step back because now it's a different role. So I had to let the respiratory therapists do their thing.
No, so I'm curious to know, and you don't have to put a specific number to this question, but we do know that nurse anesthetists are the highest paid in the profession of nursing. So how different is your salary now compared to being a RN?
It's probably roughly about double whatever is the ICU RN is making. So it's about double. This is a rough estimate.
Okay.
It changes, varies from region to region and from company to company. I cannot disclose exact numbers. It's about double what an RN makes.
Okay. So what advice would you have for someone who's interested in potentially being a nurse anesthetist?
So I would recommend that you shadow a CRNA, see what their life is like from day to day or from patient to patient. I would also encourage them to go into ICU, especially cardiothoracic. That's more encouraged. You're working with the drips, you're working with the vent, you're weaning patients off, almost like an ICU. So we do encourage going into cardiothoracic or any type of ICU is very important. At least minimum 1 year, but most of the applicants have multiple years. I had 4 years as a medical ICU. Cardiac ICU, surgical ICU, and as 4 years as a respiratory therapist. Make sure your grades are good as a nurse. Make sure it's at least a 3.5 minimum to get in. Most of these people that come in are 3.8, 3.9, 4.0 GPA. So it's very competitive. So yeah.
Wow. When you said 3.5 minimum.
At least minimum, because most of these people are, most of the applicants are very, they have multiple careers. They're EMS, they're flight nurse, they're very experienced. So you have to be wide
on top of your game because you're competing against the best of the best.
Yes.
If someone wanted to get into healthcare and they were torn between respiratory therapy and being a registered nurse, because I think respiratory therapy may be a faster track to getting to that point, what would your advice be? You haven't been in both positions. How would you advise that person?
That's a hard question. That's very hard. There's benefit to both of them. As a respiratory therapist, you could do 2 years. Now is required. I think it might be bachelor's right now. I think they increased it to a bachelor's degree too. But you could get a job and sit for the exam for 2 years associate, and you could come out in 2 years making about 70 to 80,000, which is a lot.
They do 12 hours just the same. They work 3 days. So
they work 3 days. Yep. As a respiratory therapist, you could go into PFTs. You could do sleep testings. You could do stress test, PFT labs. There's a little bit, and also you could do management. I didn't want to do any of those. And with nursing, you have a little bit more, variety of things you could do. If you're going to be happy with what you are and want to get it done in 2 years, respiratory therapist. If you're kind of person that's not going to doesn't like to settle down and gets bored very fast, I think nursing would be, you have a lot more opportunities. But they're both great professions.
Yeah.
Great, you're helping patients. And good salary.
So potentially would depend on career goals, ultimately, which direction you want to go in your career. Like you said, if you just want a job, you want to get paid and do it quickly and not really worry about the different variations or the career ladder, then respiratory therapy may be a better choice, whereas nursing is, maybe a little longer, but it does offer you more options and flexibility in your
And during this time of COVID, and they were the unsung heroes, I just wanted to say thank you to all the respiratory therapists that was out there. A lot of times you don't hear about respiratory therapists until
I was just gonna say that. So sometimes I feel like it's just a profession that people may not really know much about. Because even most nurses, how do you really interact with the respiratory therapy unless you're in the ICU setting? You guys have that partnership because, you call respiratory and you know who's coming, they're intubating or they're there on a day-to-day checking on the patients and changing the different settings. But on the floors, they may be giving a treatment. If the patient's on BiPAP on the floors, and other than that, they don't really, they're not really there.
Yep.
So
So yeah, it's a profession that a lot of people don't know about, but it's a great profession. It's my stepping ground to being in the healthcare field.
well, Siju, thank you so much for your time. Thank you so much for coming on my channel and sharing your personal experience and your personal journey.
No problem. Anytime.